All right, everyone. So for the sake of time, I'm just going to jump in. We have a really amazing session for all of you today. So welcome. Thank you all for being here. We had such an amazing turnout for the first session. The attendees, the participation in our chat feature, the support, the encouragement that this community showed to one another was amazing. And I know that we're going to continue on that path through the rest of the sessions. So today the topic is risk communication. We have a great lineup of speakers for you all, but before we dive in, just a few housekeeping rules or tips to keep in mind. Please make sure that you mute your lines just to avoid any interference or disturbance for our speakers. Next, I've been getting a lot of emails, and I realize I might have forgotten to mention, as far as credits go, we will be sending out an evaluation to every person after the fourth session, so after June 30th. And you'll get the opportunity during in filling out the evaluation to list your CHES number. We'll then you'll put your CHES number and then which sessions you attended, and then we'll go through and give credit as appropriate, but we won't be giving credit, of course, until we get the evaluations completed. So just keep that in mind. Spread that word to anyone who's maybe wondering about that. I'll include it on the website as well, because I realize that might be confusing for some people. So yeah, just that on the CHES credits. And then I already touched on the Zoom, but for the people who just joined, you have to make sure that you click the link on the website to actually register, and then the Zoom link for every session will then get emailed to you after the fact. Some people are wondering how to mute your line. So on my side, I see it in the bottom left-hand corner. It's just a little mute button. So click that to unmute and to mute. It's right next to the video option. I think that's it. Of course, as we did before, use the chat feature for any questions, any insights, anything that you want to add to the conversation. Because we only have an hour, kind of what we're thinking for format. We're going to have our first speaker speak, and then while she's speaking, feel free to put any questions you have for her in the chat feature. I will keep a running list of the questions, and then we'll spend about 5 to 10 minutes after she's done speaking, kind of asking her what the questions are, and she'll have an opportunity to provide answers for all of you. So, and then anything we don't get to, we'll of course follow up with all of you. Okay, so I think that's it. If I forgot anything, I will make sure to touch on it before the session is over. But without further ado, I'm going to introduce our first speaker today. So Laura Taylor is here with us today. Laura has been with the New Jersey Department of Health in the Communicable Disease Department since 2003. She coordinates professional trainings, creates and implements and evaluates continuing education and professional development programs for public health and for healthcare professionals. Dr. Taylor has been an integral part of the Department of Health's public health preparedness for both health education and risk communication for the past 15 plus years. So she is definitely going to be a key person for this topic area and kind of giving us everything we need to know about risk communication. Her roles include leading a statewide group on health educators and risk communicators, providing skill building preparedness opportunities to local health departments, and coordinating the annual statewide public information and risk communication preparedness exercise. Laura is also one of our very own. She's been a member of NJSOPHE for a very long time. She's served on various committees, such as the program committee, the academic advisory committee, and she's also been a past president. She was our president in 2008. She's also an adjunct faculty at Stockton University School of Health Sciences, where she teaches courses in public health marketing and community health education. She has a BS in public health from Westchester University and an MS in health education from St. Joseph's University, and a PhD in health studies, which is now public health, from Temple University. So we are so excited and so grateful to have you here with us today, Laura. and to take us through some of the foundations of risk communication. So thank you.
Thank you. Thanks, Sonika. Thanks, everyone, for inviting me to speak to you. I'm very excited to share some concepts of risk communication, as well as try to integrate risk communication into what's going on now with the COVID-19 pandemic response. So that's going to be the latter half of the conversation. So how do I? So here we go. So effective health communication techniques during a crisis. So for those of you who don't know, because I've been told there's a lot of students on the that join the webinars, which is awesome. Risk communication is a science-based approach, right? So that means that there's research involved, and we know that risk communication and how you communicate during crisis is different. It's not the same for your day-to-day messages. So if we look at what is risk communication, we have to look at the psychology of a crisis. Again, keeping in mind that how you communicate during a crisis, very different from every day, you really need to make sure that what you say is very clear and consistent. And try to keep in mind that during a crisis, people really act on information differently, they comprehend it differently. So that means your messages need to be a little bit different. So take a look at the second bullet here. If it's the first emergency of its type, the communication challenges will increase. Boy, is this the case right now, right? Take a look at that very last one, a novel virus. That's what we're dealing with now. So a lot of these are things that we've dealt with in the past. Anthrax, 2002, Superstorm Sandy in 2012, train derailment, that was back 20-something. They're all kind of meshing together in Gloucester County when it was carrying a toxic gas, mass shootings, and now here we are with the pandemic. So again, there's a lot of challenges during a crisis mode, if you will. So for risk communication messages, they really need to be short, concise, and focused, which is really challenging, I think, for public health professionals in general, because we want to give people as much information as we can, right? That's always what we've been taught. And we like to give people lots and lots of stuff for them to make an empowered decision. Okay, so all bets are off the table when it's a crisis. So when it's a crisis, it needs to be short and sweet. There's something called the rule of three. And the rule of three means, what are the three most important things that people need to know? And that really forces you as the communicator to figure out what is the most important. So you really need to figure out in your message, what is the most important thing that people need to know? So again, contain relevant information. And the one thing that the risk communication research shows us is that it should be positive, right? Not don't do this, but more do this, right? Wash your hands, wear a face covering, stay 6 feet away from people, social distancing. And if possible, when you're able, repeat them. And not only you repeat them, but have all your partners repeating the same messages. Because what the public does then is go, you know, that's what this person said, that's what that person said. I'm hearing the same message, that must be important. So repeat. So short, positive, and repeat. Notice I did that in threes, right? Okay, so messages should not contain promises, you know, especially when you're dealing with something new and something, you know, information's going to change. You really want to be very cautious about what you promise. And guarantees are not always a guarantee, especially during a crisis. As you know, during a crisis, it evolves. We learn more things. So be very careful what you promise, right? Let me say, for an example, for COVID-19, it could be, you're getting your test results back in 3 days. We promise you'll get your test results back in 3 days. Now, anybody who got tested early on knows that that was not the case. And there were some issues with people not getting test results back in time. So again, be very mindful that what you can promise may not be what you want to promise. And so be very mindful of what you have control over and stick to the facts. You don't want to make stuff up. That's never good. Stick to the facts. And again, what we do a lot of times is we know information's going to change. So we try to say, this is what we know now or at this time, because we know that the messages may change. And then humor. Again, humor is useful in some situations, not useful during a crisis, right? There's nothing funny about sickness, illness, death, people losing their job. So be very mindful that humor should not play into your messages. So this slide really just, it makes you think about, so when I'm crafting the messages and when I'm communicating with the public, what do I want them to know, right? So I want them to know, if you don't do this, then this is a possibility, right? So the example here is wearing a mask. I know it's a very controversial issue. It's very politicized at this time. However, we're asking you to wear a face covering when you go into public places. And if you don't, more people could get sick. We know with COVID-19 that there's a lot of asymptomatic or pre-symptomatic people who may be sick and don't know it, aren't outwardly showing symptoms. And by wearing a mask, doesn't really protect the wearer, but it protects everyone else around them, right? So that's kind of the message, and that's how you have to think about it. So there's a lot of challenges, right? Especially with a crisis, especially with a new virus, especially in a new situation. Anticipate questions and draft messages, knowing that the information's going to change. We always try to anticipate, what do you think the public's going to want to know? And we used to go on the newspaper websites and we would read all the public comments, and that's how we kind of knew what people were thinking. Now a lot of newspapers have turned off the comments because some of them were very toxic, but luckily there's still social media. And a lot of the newspapers now post to social media. They post their stories. And if you click on the story, you can read comments. They're still sometimes very toxic, but very fascinating about how people are perceiving your message. And that's kind of what you want to kind of figure out. Is my message being understood clearly? And then correcting erroneous or misinformation. There's a lot of information out there. Again, because everything on the internet is correct, right? No, it's not correct. And there's a lot of people going to misinformation websites, getting their information, sharing information that's not great. So there's actually websites. The New Jersey Office of Homeland Security actually has a website for misinformation, for scammers, for things that are being swirling around the internet, if you will, that can correct rumors. So, we always like to read comments and try to correct things. Sometimes it works, sometimes it doesn't. But again, you have to kind of think on your feet, because the last bullet here, as the situation evolves, the information changes. Now, again, think about this in the context of COVID-19, right? So when it first started, one of the risk factors was travel. Right? So if you traveled, were in an airplane, traveled to certain places in various countries, you were more at risk. Then at some point, it turned into community transmission. So we had to evolve our message from travel to community transmission. And how do you stay safe in the community? Early on, it was not recommended that people wear face coverings, right? Especially because as PPE was limited, we wanted to save that PPE for our healthcare providers. However, again, as we learned more and as more community transmission happened, they figured out, you know what, a face covering will protect and stop the droplets from traveling. So again, we have a document that we share with a lot of local health departments that one of the questions is, okay, so before you told me not to wear a face covering. Now you're telling me to wear a face covering. Why? And be prepared to answer that. And your answer needs to be as truthful and, again, as simple and clear as possible. So let's just look at the timeline if we can, right? So in January, the State Health Department began COVID planning, and there was a whole team in place that was monitoring the situation. We got our first case in New Jersey, our first positive case, March 4th, and sadly, our first death was March 10th. But the governor really put in place executive orders to promote public health and to keep people healthy. You can see here there was a state of emergency, closure of schools and universities and non-essential businesses, and then there was a stay-at-home order, and that really played into the whole social distancing and everybody kind of stay home, so we're not dealing with this community spread as much as we would if we were all out and about. Again, keeping in mind, New Jersey is one of the most densely populated states in the country. So we have a lot of people living in congregate settings, multi-generational families living in one home. So it was a lot home-wise as well as out in the community-wise, right? There was many things going on, meetings and conferences and business as usual. So that stay-at-home order really limited people's movement in the community. So as Sonika said, I'm with the Communicable Disease Service, and we are one of the departments responding. So there's 2 other health educators with myself, and what we do is we work with the hotlines. Like, for instance, did you know that there's 3 hotlines that are currently up and running? We work with the Poison Control Center, and that is staffed by health professionals. So if you're a health provider or if you have a health-related question, that's the number to call. We're working with 211. So if you have a question about your utilities, or if you are food insecure and need to know where I can go to the food bank, you will call the 211. And then we have a communicable disease hotline for local health departments to call with specific questions. So we try to coordinate all the messages and how to respond to a lot of the questions. Now, working with these hotlines also helps us know what's going on and what kinds of issues are going on with people in the community. Early on, it was testing. Where can I get a test? I want to get tested. So we coordinated, and really worked with the COVID-19 website to list testing sites. We've created lots of educational materials, and at the end I have a list of some that you may be interested in. Everything from what is it to what is social distancing, to what's my risk, to a brand new one as we reopen, about time, space, people, place, about really having people remember, you know, it's the time that you're around people, it's the space you want outdoors, not indoors. It's the space and the place. You know, you don't want to be sitting too close. You want tables 6 feet apart, that type of thing. And we engage translation services. We know English is nice, but people speak all different types of languages. We've gotten things translated into Spanish and Haitian Creole, and there's Chinese and many other languages. So we have multi-language materials that we have on our website. And then we were in constant communication with partners and stakeholders. We're constantly on webinars and conference calls, working with people, taking questions. So unfortunately, when you're constantly on calls and webinars and in meetings, you know, you don't have a lot of time to come back and do things. So that's always a downfall when you're constantly working and being involved with all the activities. Sometimes the communication doesn't roll downhill, so to speak. And then we are posting guidance and providing technical assistance for various settings. I believe there was a webinar yesterday for local health departments on youth camp guidance and pool guidance. And there's all kinds of guidance posted for personal care folks, like the barbershops, the hair salons. There's everything is posted on the websites. So again, posting on the websites takes a lot of time and putting it in the right place where people can find it. But again, there are some challenges that we are experiencing. Again, there's a new virus, lots of unknowns, you know, and what was true in February or March may not necessarily be true right now. We're learning more. We're learning more every day. For example, like early on, we thought COVID-19 didn't really impact children. Now we're seeing that it's impacting some children, and it's very similar to a Kawasaki disease with the rash. So we're keeping an eye on that, and we learned that from pediatricians seeing these children come in and saying, hey, I'm seeing a couple children, this looks a little odd. And again, that's how we know what's going on out there with different partners letting us know. A lot of unknowns, stigma and uncertainty. Unfortunately, when this thing started, it started in the Asian countries. And unfortunately, a lot of Asian Americans and Asian communities have experienced stigma and violence and just hate, which is unfortunate and terrible, and it should not be the case. And so working to try to combat that stigma, that this is a virus. The virus knows no racial or ethnic lines. It kind of just will impact anyone. And then we do have some federal guidance. We kind of Jersey-ized, if you will, what the CDC puts out, the Centers for Disease Control. There's been quite a few revisions. You know, we take down old guidance, put up new guidance. For instance, when early on it was, so if you're sick, you should stay at home and self-isolate for 7 days. And then all of a sudden that changed to 10 days. Right? Because what the researchers found was people are still shedding the virus longer than 7 days. So now they're saying, all right, so change 7 days to 10 days. So that happens, and staying up on that and then communicating those changes to our partners, very, very much a challenge. And again, I remember I mentioned we have so many different materials. We had to figure out which materials we put all these numbers on and go back and change them and update them. So it really is quite a challenge. And then lack of testing early in the response. You know, there was some issues with testing supplies early on, and it was communicated, anybody that wants a test can get a test, right? And we know that was not the case. That was not the case until recently. So lack of testing caused a lot of frustration with people because they said, anybody said, if I want a test, I can have a test. And again, how do you write the message that says, right now, due to limited testing supplies, we're only testing the sickest people? And then combining that with, well, but I'm sick, but you're not being admitted to the hospital sick. So trying to explain to people what that meant. Again, very much a communication challenge. And we also saw our hospitals being overwhelmed. Again, if you don't need to go to the hospital, don't go. That's not the place to be right now, right? Call your healthcare provider. Telemedicine became very popular. And so, you know, we would write in our messages, you know, call your healthcare provider and see if they can do a telemedicine visit, either on a FaceTime or just over the phone. There was a lot of mixed messages due to unknown and evolving situations. Again, with the children, anything involving children really evokes such a great response, an emotional response. The whole wear a mask, don't wear a mask. So a face covering is different than a mask. So save the masks for our healthcare professionals doing patient care. And a face covering can be something simple that you fold up a t-shirt and wear. That is a really uncomfortable face covering, but it's fine. And the mixed messages, a lot of people just didn't want to wear a face covering, and kind of explaining to them why it's important. You know, the face coverings are hot they're uncomfortable, but you know what? This is what we do for our community to stop the spread. Remember, when I wear a face mask, it's not to protect me, it's to protect you. So it would be very cool if you wear a face mask to protect me. Misinformation is everywhere. I can't tell you, Facebook is really like ripe for misinformation. But again, knowing where to go to get the correct information, knowing credible sites. Like I mentioned, the Office of Homeland Security, New Jersey's own, has a whole misinformation website, as does other government sites. I know that people don't always think government is the most credible, but really they are doing a good job trying to crack down on misinformation and explain to people where to go get the right information. And now the challenge with reopening, right? So now what is safe? Do you feel safe going out? And writing those messages. Again, also challenging. So going forward, we're going to continue with our prevention messages. We are going to have a hand washing campaign in the fall where we have clings, because now we've noticed everybody's put up these partitions, right? The clear plexiglass. So we have these window clings that we're going to have. So again, contact your links agency or your local health department. We will be sending them to them so that they can distribute to various partners. Will there be a second wave? We don't know. Probably. However, hopefully we're better prepared to deal with it. You know, our hospital capacity is getting better. Our prevention hopefully is working. You know, it's very frustrating to see numbers go up in different places and you look around and nobody has a mask. People are standing really close together and you're like, no, social distance, wear your face covering. So again, what are some ways that we can prevent the second wave? And then contact tracing. Again, contact tracing, not new, but the messages to get people to answer the phone are very challenging. I don't know about you, but I don't answer any number that I don't recognize, especially if it's from a place that I know no one. So how do we deal with that, and how do we get the public to answer those calls? And we have had evidence of scammers calling people, which is why we've tried to really put the message out. You know, a contact tracer will never ask you for your social security number, your health insurance information, your criminal background. They won't bring that up. Your immigration status. We don't care, right? We want to know, you know, do you have symptoms? Who do you live with? Are they sick? That type of thing. And then now there is enhanced testing. If you go on covid19.nj.gov/testing, there are over 200 testing sites across the state. Many will test asymptomatic as well as symptomatic. Many you do not need a physician prescription to get tested. So there's, you know, different types of testing though, you know, and that's another challenge. So there's the diagnostic test, which includes putting the swab up your nose or spitting into the vial. That diagnoses you, do you have it at this moment, as opposed to antibody testing, serology testing, which best to have the blood taken from your arm. And that shows, you know, do you have antibodies? Were you exposed to the virus? So there's different types of testing, and explaining the different types of testing. That again is one of the messages that we're working on. And then again, working with our partners to help us get all those messages out and to make sure we're all on the same page saying the same thing. So just in closing, risk communication principles, we use them and we tailor our messages. We really pare down things that we say. We try to work with our partners so everybody's on the same page. And again, we try to anticipate information and how people will respond. So again, we're tailoring our messages. We're making sure that our messages are meeting the needs, although a novel virus is very challenging. And then, you know, time will tell, you know, how well we do. I think that we're doing a pretty good job. We did a good job flattening the curve. We have a whole bunch of new words in our vocabulary now that we use, but hopefully our second wave, if it does come, it will not be anywhere as horrible as the first wave. So this is just some of the materials that we have available for you. Again, many of these are in multiple languages. This is our website. It's the nj.gov/health/CD. CD stands for communicable disease. We have fact sheets and health actions and information about isolation and quarantine. They are different. Isolation is if you're sick, right? The I in isolation, sick, and quarantine is if you're not sick, but we kind of need to watch you. Information on face coverings, information on antibody testing, and one of our brand new ones is the time, place, people, space, which is a really cool material, and that was recently just translated into Spanish. And then we have information on the multi-system inflammatory syndrome if you work with parents and parents want to read up more about it. And then we're also working with messages for the seasonal farm workers to keep them safe. And I think that's it.
Awesome. Thank you so much, Laura. And I'm sure if you're not paying attention to the chat, it is definitely busy in there. So I have some questions for you. Thank you everyone for sending your questions in. I know we're not going to be able to get to all of them. So Laura, I hope that we can bug you afterwards and sort of ask you some of these questions. Okay, cool. So I think the first kind of bucket of questions that we're getting is really around like channels of communication. And I know you kind of touched on that, but with social media and, websites, and like what's for someone who doesn't have the platform of being part of a health department, or, it's just your own social media page, whether it be Facebook or Instagram, like what are the best ways to communicate from a channels perspective? And does it vary? Like obviously it would vary based on the audience. So when we think about like college students or, just the younger population in general, is there a specific channel that you would recommend as being, a more effective than another? And then so how does that differentiate, and how do we best be able to decipher which communication channels are best?
So I would say make sure that whoever you follow, if we're going to talk about social media, right? So social media, Facebook, I know that people you went to high school with or are friends with may not be credible information, but the Department of Health has a Facebook page, as does NJSOPHE, as well as other organizations that are credible. Department of Health, CDC has web pages, and they have Instagrams, they have Snapchat, they have Twitter. I mean, I get a lot of information from Twitter, but I follow very certain people. I follow the Department of Health. I follow the governor because I need to know what's going on to write all these messages. So, every day I watch his briefing because that's how you know what's going on. So you need to make sure the people you follow are credible people where the information is real. But I would also recommend that you look at the New Jersey Office of Homeland Security page. Really fascinating with all the scams and all the misinformation that you're like, I would never have even thought of that. How do they do that? So there's a whole lot of interesting things to follow. Again, health departments, federal partners, that type of thing.
Awesome. Thank
you. Instagram. I love Instagram. I love pictures. I'm a very visual learner, but yes. But Twitter is nice because Twitter's like immediate.
Right. Yeah. I think each channel sort of has their pros and cons. And I think you brought up an interesting point about Instagram and using visuals, because I think that's sort of been the savior in people being able to digest information are these visuals. At least even for myself, being a public health professional, I still prefer visuals over, text.
Right.
And that sort of brings us into another question around health literacy. The concept of health literacy, how is it being applied? A lot of the topics that we talk about when it comes to a pandemic, even the word antibody, does everyone even know what that means? And so how are we taking health literacy into consideration, and are we explaining these terms in an explanation? Is that something that it should be prioritized, and how is it being executed, I guess?
Yes. So like I mentioned earlier, there's two other health educators that I work with. So we're kind of like, we're the health education and communication team, and we are all very entrenched and well-meaning with health literacy. Like when we write things, we really write it as if we're trying to talk to a fourth grader. Although I say that, and these fourth graders are really smart these days. So I don't know if that's a fair statement, but we try not to use the polysyllabic words. We really try to use layman terms. And if we do use a fancy word, we, put like what it means in parentheses. With this pandemic, as well as a few other things that have happened recently, we're all learning more words in our vocabulary that we've never used before, like very epidemiology words and prevalence and incidence, and not everybody uses them correctly. So we do try to use everyday language that people understand, but still try to keep the construct clear, and try to explain what we mean by that. So we definitely insert health literacy. We've all been doing it for many years, so I kind of think like it's just a given, it's a natural, but we do look at, would the average Joe get this? So when we write materials for the public, we do write them one way, as opposed to when we write things for health professionals. Although I'll be honest with you, as a health professional, I appreciate you using real language regardless. Like, you don't really need to step it up for me. I appreciate you just giving it to me. Like, what are the basics? What do I need to know? And we also try to use bullets because nobody has time to read all that stuff. And we try to use a lot of graphics for low literate people, right? So if even though we get things translated, we know that just because a person speaks Spanish doesn't mean they can read it. Just because they speak Haitian Creole doesn't mean they can read it. So we do try to use a lot of graphics when we can to really, like, if you look at it, you kind of get the gist of what's going on.
Yeah. Interesting. Okay, so switching gears, we have a lot of attendees that have young children. And so I know you mentioned how initially, we didn't think that it could spread to children, or children could be as impacted as, adults. But just around children needing to wear a mask, needing to social distance, now that they're going back to school, like they don't understand these concepts of social distancing. Like, what do you mean that I can't stand? Like, they don't know what 6 feet is. And so is there a resource that is out there for children specifically, or for parents rather, and how to educate their children, or what they should be keeping in mind when it comes to their children, even with going back to school? Like, where do parents even start? I guess I think that's a whole different realm,
Right.
parenting.
So I think there are some resources at the New Jersey Department of Human Services. That's where DCF, Department of Children and Families, they have great resources, great visuals, great resources for parents. I think the CDC might have some, but again, CDC likes to write way up here. But the New Jersey Department of Children and Families has great resources. It is going to be challenging when kids go back. I mean, the classrooms are going to look different. They do say no one under 2 should be wearing a face covering. So, explaining why they're wearing one and you're not is, again, a conversation that parents need to have. But I think parents can take this opportunity now, before the kids go back, and kind of explain what's going on and really get that. Now, we clean this after we touch it, like the remote control or the door handles, and why we do that, and really integrate that into everyday living might be a good place to start. But like I said, the human services folks have excellent materials.
Awesome. Thank you.
Sure.
So we didn't obviously get to every question, but I want to make sure that we have time for our next speaker. So I will definitely follow up for anyone who asked a question and it wasn't answered. We will definitely make sure that we ask Laura and get back to you. We're going to be sharing her presentation in some capacity with everyone, if that's cool with you, Laura. And then also, if you're open for it, Laura's contact information. I think that, a lot of these questions on the antibody testing and the second wave, these things are going to be becoming more prevalent as time goes on. And so people will definitely have questions. So we'll definitely keep you all informed on how to get the answers and how to communicate and get in contact with Laura if you want to. So thank you so much.
Welcome.
Such valuable information, and we really appreciate you giving us this time today.
Sure. Thanks for having me. And I've seen some of the comments. Department of Education is also a really good one, and about anxiety, because a lot of kids might not understand what's going on. So that's also an awesome resource. Thanks, Connie.
Cool. Thanks, everyone. Okay, so now I want to move on to our next speakers. So they are two individuals who you might be familiar with. They are part of our NJSOPHE board, Tiffany Neal and Carolina Focella. So just going to give them an opportunity to get set up, and then I am going to hand it off to them. But just in the meantime, just so you know who they are, Tiffany Neal is a communications coordinator, for NJSOPHE. So anytime you get a communication from us, she's the mind behind it. Other than her role at NJSOPHE, she's a freelance public health consultant, including roles with New Jersey Healthy Communities Network and local health departments. So she definitely has a fair share of experience with risk communication and just communication on public health topics in general. We also have Carolina Focella. So she is New Jersey SOPHE's networking chair. So if you attended any of our wonderful networking sessions in person, virtually, she's been sort of behind that. She's also on a day-to-day, her job in public health. She's a research coordinator at NYU. She in the Department of Environmental Pediatrics. So both individuals bring a lot to the table when it comes to communication, health communication, and they're going to talk to us about, their approach when providing communications on public health topics for NJSOPHE, sort of best practices that they have, cool tools that they use. So yeah, I'm going to stop talking and kind of hand it over to them. So take it away, ladies.
Okay, thank you so much, Sonika. So just a real quick overview of NJSOPHE Communications. We have a variety of platforms that we use. We have content on our website. We send out emails to members and other contacts. We have our forums on our website. I want to put in a plug for those. Anybody who's a member of NJSOPHE, there's a special members only section of the website that you can access when you log in. And we have one forum for job postings, another forum for advocacy opportunities, and another forum for professional development. And so that's the way that you can get this insider information as an NJSOPHE member. Please go check that out. And of course, we have social media. Over the past year, we had already been planning to expand our social media presence beyond Facebook, which is all we had. And after listening to feedback from our member survey, we joined LinkedIn on February 21st and joined Instagram on March 1st. And then the public health world kind of exploded. So now, separate from just all of the COVID-19 things, so much of our professional work lives have moved online and virtual that social media is more important than ever before. You can't neglect it in your work as a health educator, no matter what setting you might be working in. You have to find ways to integrate it as a key part of your work. So we're going to be focusing on social media during this part of the presentation.
Great. So hello, everyone. Welcome. My name is Carolina. So I'm going to take a moment just to talk about kind of, as Tiffany mentioned, we really listened to our membership survey, but what were our goals in that? So I really wanted us to be a source of trusted health information. And as Laura mentioned, it's critical, to have that portion whenever you're sharing information to be a trusted source. And also as someone who is communicating, you need to make sure that your information is accurate. And so that's kind of been one of our goals through the NJSOPHE social media channels, is just to really make sure that we are sharing trusted information from CDC, the Department of Health, anyone that we see as really credible. We also wanted to increase engagement among other health educators, connect other health educators to each other. Social media is such a great platform for people to connect and find each other. And then also to actively promote our organization. For those of us that are members, we know how great NJSOPHE is, but for people that don't know us, this is just another way to get our name out there, expand membership, and connect with other organizations that are public health based. Perfect. So as mentioned, we have a Facebook page. We also recently have an Instagram and LinkedIn, which is super exciting. LinkedIn has two different platforms options that we use. So we have a LinkedIn page, and then we also have a LinkedIn group, which is really great for facilitating conversations. If you are a part of the LinkedIn group, you can post a question, you can post resources, and that's something that can't be done on the LinkedIn page per se. That's more so Tiffany or I posting and sharing links to interesting articles, sharing infographics from the Department of Health or CDC. And so those are the main platforms that we use based on our overwhelming response from the strategic survey that we received.
In terms of Facebook, Facebook is the oldest social media platform that we've been using for years as NJSOPHE. There's a little screenshot of our Facebook page. We currently have between 600 and 700 followers. They sometimes increase in spikes. Like they had a huge increase in March of this year. I can't imagine why. But we post a variety of things based on what members told us they were looking for in that member survey. We post news stories that are relevant to health professionals in our state, educate folks about advocacy issues. That was the topic of our first session last week, and it's really a priority in our organization. It's one of the 5 main points of our strategic plan is advocacy. Sharing health education resources. These are the types of things, communication resources like Laura talked about, that we can share them on Facebook, and then you guys see them and can share them with your own networks, both professional and personal. And of course, promote events, both our own events as well as other webinars, trainings from other organizations that we know and trust. Carolina, you're muted.
Yes, got it. Our Instagram page is new, as we mentioned. So this has been great. Just to clarify, we don't just have a regular Instagram account, we have a business profile. And while we are not a business, we can choose that we are a nonprofit organization. Instagram allows you to choose the option if you are a personal blog, if you are a retailer, you can also link your website. So currently, the screenshot that I have has our NJSOPHE website on there, and then it also has links you directly to the upcoming events to promote our mid-year meeting. So there's some benefits that I wanted to talk about, which is really great for those that are not familiar. You can save your Instagram stories, which are normally only live for 24 hours. There's also a go live option, which is available for every single type of profile, in which you can engage or link with another professional account and have a discussion and have people chime in via the comments, which is really exciting. And your stories you can also save to our highlights. But you can see on the business profile, it does give you these few extra options of promotions and insights, and your email, which is great. So you can access those, which we'll talk about a little bit later in terms of the insights, but that is kind of the benefit of having a business profile. So our LinkedIn page is really great. We have a page and a group. So what I have screenshotted here is Tiffany and I's LinkedIn profiles. So this is how we were able to link our NJSOPHE page to our accounts. Now, what's great to this, which it's a screenshot, so I can't show you, but if you were to look on my LinkedIn page or Tiffany's LinkedIn page, you see the NJSOPHE logo, and you're able to click on that and it'll bring you directly to our LinkedIn page. So Tiffany, you can move to the next slide, I'll show you what our page looks like. So this is what our LinkedIn page looks like. And again, you would create a business page, even though, let's say like you're a nonprofit or you're a health department, just because it gives you these added benefits of, you know, the analytics of being able to have other team members, let's say, or volunteers, link your profile to, or your page to their personal profile. And so that's really great because people are on LinkedIn every single day and people are, you know, browsing through, again, visuals are great. And so people are clicking on, oh, I'm not familiar with that logo, or, oh, you know, I've seen that before. Let me click on that and it'll bring you right to the page. So that is really exciting. And then we also have the LinkedIn group. And this is more like we can invite people can join, and really facilitate discussion. So here's my latest post, you know, this is our flyer for our mid-year meeting, everybody share. And on the flyer, there was a hyperlink. So we have 51 members total today. And it's really just a great place. If you have a question about NJSOPHE, if you have a question as a health educator that you're not sure how to, you know, how to really go about, reach out to your contacts here. I know sometimes, you know, it can be intimidating to engage with people that you don't know, but we are a very friendly bunch. So please, you know, go ahead, join our LinkedIn group. Tiffany and I will accept you right away. Unfortunately, you do have to be accepted, but we accept everyone. Everyone is welcome. So yeah.
So how do we manage it all? We use a tool that some of you may be familiar with called Hootsuite, and that really helps a lot trying to keep everything organized. So first of all, it allows you to manage multiple streams from multiple social media accounts and platforms all in one place. That helps to keep everything straight and know what you're posting and messages and so forth. It also allows you to schedule posts. And since I first started using Hootsuite years ago, Facebook did implement an option to schedule future posts, but it's really buggy and hard to use, speaking from experience. So really excited that we can still use Hootsuite. Just for your reference, there is a free version of Hootsuite that's fairly flexible. It allows you to have up to 3 social media accounts. So for example, a Facebook, a LinkedIn, Instagram, and you can schedule up to 30 posts in advance, which is pretty generous, I feel like. And you can only have one user, but we just have the user as NJSOPHE, and Carolina and I both share that login. So that's definitely a tool you can use in your own professional life. You can see in the screenshot here, I have various feeds from Facebook in this example. So the first column is scheduled posts, second column is past posts, third column is where people mentioned NJSOPHE, so it's a great opportunity to boost engagement, and the fourth column is messages to the NJSOPHE page. Analytics. Earlier, Carolina mentioned the benefit of doing a business page is that you get the analytics information, and that's really beneficial. As public health professionals, we all know that evaluation is important. And in terms of social media, it helps you learn more about your audience, create better content to reach them better and give them what they want. And through that, improve your reach, improve your engagement, which is what the whole point of this exercise is. So here's some examples of what the analytics look like that are built into Facebook. This first one is an overview of analytics, and you can see, for example, it shows you your post reach right in the middle there, engagement, page views, and you can look at different periods of time. One subset that I really like to look at is posts. So that blue curve at the top there shows what time of day are people looking at our page. And so that gives you a good idea as to what's the best time of day to post our content where the most people are likely to be on Facebook and looking at the NJSOPHE page. Down at the bottom there, you also see different posts that we made and how well they did. How many people did they reach? How many people engaged, clicked, shared, etc. And so it can give you a hint as to which type of posts are the most engaging and the most popular, and you can do more of those posts in the future.
Make sure I unmute myself. So Instagram has similar analytics, which is kind of what Tiffany shared as well. You can go into each individual post, which you'll see on the far right, and you can see how many people, so the heart stands for likes, the butt moving to the right, then we have comments. The arrow is how many people sent this post to other people, which is really cool to see how many people sent this via direct message. And then the last kind of post insight is how many people bookmarked it or saved it. So that's really cool. And then we have the same, how many followers we have. It breaks down by gender, location, age range, which is really cool. And then you can also see your reach on each individual posts, which is great.
So we are at the end of our time. We've got a couple minutes for questions. I will say that not only will we be sharing this PowerPoint, but if folks have further questions for me or Carolina, you can get our contact information on the NJSOPHE website if you go to, I think it's About Us and Executive Board. But we have time for a few questions right now. One question from Samantha is, what are some data points in the analytics that you use the most?
I think for Instagram, I think a huge one, I think if we go back, let me see, I think it's one slide, that I look at the analytics, this is perfect. If you look under gender, there is followers. And again, it shows you like, different times of the day, how many people are active. So I love to use that as a guide for when I post my information, because again, like we work really hard on our posts to make sure the language is perfect, the design is good to capture people, but it doesn't do you any good if no one is seeing your posts, right? So that's a big tool that I use to kind of engage followers.
Another question, is Hootsuite a better option than buffer.com? I did some research when we started to incorporate more social media platforms with NJSOPHE of different social media management software, including Buffer and Hootsuite and several other options. We ended up going with Hootsuite because the value was the best. So it had the best options in a free plan because since we're a small nonprofit with a small operating budget, we didn't want to have to pay for social media management. So we've been pretty happy with it.
Awesome.
I think we're out of time. So Sonika, if you want to wrap us up.
Yeah, for sure. Thank you, ladies. I think the NJSOPHE social media platforms and effort has grown so much in the last year, and it's really due to these two. So thank you guys. And if you have a nonprofit or if you know of anyone who has a nonprofit, hopefully these tools, how to get the most out of these social media networks is helpful to you. And as Tiffany mentioned, if you have any other questions for them, feel free to reach out to them directly. Reach out to me. I will communicate it to them. But thank you all for joining. I know this is during your lunchtime, so I really appreciate it. Thank you so much to Laura, Carolina, and Tiffany for speaking and providing some really important insight. Just a reminder, the evaluation will be sent out after the 4th session, so be sure to include your CHES number there to get credit for the session that you attended. And I think that's it. So thank you, everyone, and we will see you all next week, hopefully for session number 3. Have a great week and weekend. Bye, everyone.
Bye. Thank you.